Hi, everyone. This is your brother Kofi. Today, we're going to look at Medicare and Medicaid. Let's look at whether you are eligible and how you can apply for it. Okay. The good news is Medicare and Medicaid is available to everybody in this country. No matter, no matter where you are in America, it doesn't matter the state you live in, you can qualify for Medicare and Medicaid. So I want us to look at the basics of Medicare and Medicaid. All right. Now let's get to it. I'm going to share my screen and then we're going to look at some things real quick. Okay. So this is it. Let's start. Um, Medicare and Medicaid. What is it? Now we're going to first look at Medicare. Well, Medicare is a health insurance program that is run by the federal government. It's available for people 65 years or older. It's also available for people under 65 but with certain disabilities, okay? People with end-stage renal diseases also qualify for Medicare, all right? Now, Medicare, like I said, is a federal program, and so is managed by CMS, which is Center for Medicare and Medicaid, okay? Services. CMS, Center for Medicare and Medicaid Services. They manage Medicare. Enrollment is also managed by the Social Security Administration or the Railroad Retirement Board. Okay. Now, who is eligible for Medicare? This is very important. Well, you must be a U.S. citizen, or you should be a legal resident that have lived in this country for about 5 or more years. Then you can qualify for Medicare. All right. It's also, some of the requirements also varies from state to state, so we can also find out more to know whether we're eligible. But the good news is it's available to everybody in this country. All right. Now, you must be, like I said, U.S. citizen or a permanent resident or legal resident and have one of the following. You should be diagnosed, if you are diagnosed with ERSD, end-stage renal disease, or you've been diagnosed with ALS or the Lou Gehrig's disease, or you are 65 years and older, like I said, or under 65 with disability, and you receive Social Security disability benefit for 2 years or more, you are eligible to apply for Medicare. Okay, it's very, very important. Now, Medicare is divided into 4 parts. Excuse me. We have Part A, Part B, Part C, and Part D. And actually, there's a lesser known part called Part E that is available to our senior citizens, mostly in the rural areas. Okay, we'll look at that. So Part A covers your hospital. Okay. Anytime you go to the hospital, your hospital insurance is covered by Medicare Part A. When you stay in the hospital or you stay in a skilled nursing facility or you are in hospice care, Part A takes care of that. Now, Part B takes care of your medical bills. Okay, that's the medical insurance. It helps cover for your doctor services, outpatient care, durable medical equipment that you may need for your health, and other medical services. The Part B covers that. Now, if you enroll in Medicare Advantage, which is the Part C, okay, if you enroll in Medicare Advantage plan, then what it means is that you must continue to pay your Part B premium. All right, we'll look at that. It's a little confusing, I'll explain. And then we have Medical Part C, like I told you, Medical Part C. It's called the Medicare Advantage. The Part C includes Part A and Part B, and sometimes Part D. It's all in one plan. So if you put A, B, and D together, it gives you Part C, right? Okay, and then the Part D in itself is more for your prescription coverage, okay? It helps cover for many outpatient prescription drugs, Some are very expensive, so you need that. If you enroll in Medicare Advantage, which is the Part C, okay, then the plan will usually covers Part D for your prescription. All right? Okay. Now, and I was telling you about Medicare Part E. It's like I said, it's a lesser known part of Medicare law that regulates other miscellaneous programs. But I said this is just available in very limited states and is used by our senior citizens in mostly rural areas, our elders in the rural areas of Ghana, of the US. The program is for all inclusive care for the elderly. That is what it is. Program for all inclusive care for the elderly, called PACE. It's not known, so but it's now you know it. All right. Now, how do you apply for Medicare? Well, there are 4 steps. Step 1, you need to determine your eligibility. I've already told you how to determine whether you're eligible or not, so we know that. And then step 2, you need to choose your enrollment period, the time that you want to, enrollment method, how you want to enroll it. And then step 3, you gather your documents. Documents includes stuff like your social security card, your house address, your, a mail that shows where you live. It shows your physical address and stuff like that. You need to gather all those and other, supporting document that shows that you're legal. Okay. And then step 4, what you do is you put your documents together and then you can call Medicare office by phone. The number is on the screen right here. You can call this number, or you can actually go in person, make an appointment and go to Social Security office in your area, your local Social Security office, wherever you stay, wherever you live, the Social Security office. You can go there in person and apply for it, or you can check them out online, socialsecurity.gov, and apply for it. Okay, so this is how you apply for it. It's pretty straightforward. Now, excuse me, original Medicare is made up of Part A and Part B. Okay, that is what is known as the original Medicare. Okay, now normally you apply for the original Medicare and then you can also add a Part D to it to cover your drug, your prescription medication. I mean your drugs and prescription and stuff like that, or the drug coverage. Now, normally the Part A, you pay 0 in premium. It's free. All right. And then the Part B is based on your income. So if you're a low income earner, you may even pay nothing for Part B. And so is the Part D. If you're a very low income earner, you don't pay anything. So you can actually get Medicare for free. You don't need to hide in your room in silence. Like I was saying in my previous video, a friend of mine, an African brother that I met the other day, was hiding in this room because he thought he couldn't go to the hospital. That is why I'm making these videos. It's important to know that if you need something, please reach out, call, and let people help you out. Don't just hide in your room, because that's not going to solve the problem. It's rather going to make it worse. Okay. So now, what about Medicare Advantage or the Part C? It includes Part A, Part B, and Part D all combined. And like when they say more, it means that there's also Medicare supplements that you actually get from private insurance companies. It's called Medigap. The Medigap means that if there are still other coverage that you are missing, the Medigap covers the gaps. That's why I call Medigap. Covers that gap so you can be able to get coverage. All right. So that is it. We have original, which is made out of Part A and B, and then you buy Part D to help you get coverage, or you can just apply for Part C, and it comes as a bundle. Okay. Again, you might get it for free depending on your income. So please remember that. All right. Now, when can I first enroll in Medicare? When can you enroll? Well, you can enroll when it's about 3 months to your 65th birthday, 3 months before you turn 65, and 3 months after you turn 65, you can enroll. Okay. And also there's a 7-month window called the initial enrollment period where you can actually enroll into Medicare. We'll look at the enrollment period later, but you should know that. And then, excuse me. Now, anyone who is already getting Social Security benefit, okay, will automatically be enrolled in Part A and B. Starting the first day of the month, they turn 65. Okay? And then also individuals with disability who are under 65 are also automatically enrolled in Part A and B the month that they start receiving their benefit. Or let me say that again. So individuals with disability who are under the age of 65 are automatically enrolled in Part A and B the month after they have received their Social Security or Railroad Retirement Disability benefit for 24 months. So if you have some sort of disability and you are less than 65 years old and you've been receiving Social Security benefit for about 2 years, there you go. You automatically be enrolled. And then also, like I already talked about, individuals, okay, with ALS, Lou Gehrig's disease, or the big medical term called amyotrophic lateral sclerosis, or the Lou Gehrig disease. If you have that, okay, now you're gonna get Part A and Part B, and then it means you're automatically going to be enrolled the month that your Social Security benefit begins. Okay, so there you go. Mostly you're going to get automatically enrolled, but you need to check it out to make sure you're actually enrolled. All right. If you are new to Medicare, if you are not working, people that are working and they turn 65, they automatically enroll. But if you're not working and you turn 65 or you're after 65, you can still apply or be enrolled in Medicare. All right. Now, the only part you can enroll is Part A and B because that's free. Part A is free, zero premium. Part B depends on your income. All right. And so if you have low income, you may get it for free or might get it something peanuts that you will not even sweat paying for it. All right. But the first time you enroll in Parts A and B, you go to your Social Security office. You can call the office and make an appointment, or you can apply online, or you can take a phone call and you can get enrolled. You make sure that you have all your documents ready, and then you also prove that you're a legal citizen, okay? Then, if you want Part D, which is for your prescription, or you want to apply for Medicare Advantage, which is the Part C, or you want to get supplemental Medicare, which is called a Medigap, now you can work with an agent to get that extra coverage. Well, your brother is an agent. I am a licensed independent agent broker and a broker in the state of Arizona, but I can also sell in almost all of America. So if you need help, just give me a call. My number, I'll show you my number at the end of the presentation, but my number is cell phone 608-949-0239. There are other ways to get hold of me. All right. But if you need it, please reach out. Okay. That's because I'm here to help. Now, these are the steps that, help you enroll in Medicare. Okay. If you decide you want to get coverage, you realize you don't have it and you want to get coverage, the first step is that you enroll in original Medicare, which is Part A and Part B. The Part A is for hospital insurance. Part B is your medical insurance. You enroll in that. And then you can decide to add the drug coverage, which is the Part D, to help you cover your prescription and drugs, okay? And then if you still realize that, okay, there are some things that you might need, then you can enroll in what we call the supplemental coverage, the Medicare supplemental insurance, called the Medigap. That will help you cover other gaps, in terms of, premium payment, okay? That is how you enroll. And that's how you get coverage. Sorry, that's how you get coverage. Or you can also say you can enroll in Medicare Part C. The Part C combines Part A and Part B and usually Part D. So you have Part A, B, and D together when you enroll in Part C. Okay. Then after that, you can also decide to say if maybe you have more prescription drugs because of your condition or your medical situation, then you can actually also enroll in Part D so you can get more coverage for your prescription drugs and your prescription needs or medication needs. So that's how it is, okay? Now, but here's the clue. Here's what you should know. I want you to note this, that if you join or if you enroll in the Medicare Advantage, which is the Part C, you can use excuse me, you can't be sold a Medicare supplement. You can't get a Medigap. Okay? For some reason, I don't know why, but once you enroll in Medicare Advantage, you cannot get a supplement, the Medigap. So you can go through the regular route, enroll in Part A and B, add the Part D to it, and then you can add the Medigap to it. Okay. Let's look at the enrollment period. When can you enroll? Well, there are a lot of enrollment period. I mean, even it looks like even throughout the year. So let's look at the first. Then first one is the initial enrollment period. That is 3 months before you turn 65, or 3 months after you turn 65 is the initial period. That's the very first time you can enroll. You can enroll in Part A, Part B, Part D, and the Medicare supplement or the Medigap. Like I told you, if you are the first time enrollee, you can do that. Now, we also have the annual enrollment period, which is from October to December 7th, right? At that period, if let's say you already have Medicare, you can change your plan. You can drop a plan and enroll in another one. Let's say if you have the original, you can drop it and then enroll in the Medicare Advantage, Part C. And then you can add Part D to it for a prescription. Then we have open enrollment period from January 1st to March 31st of the year. For every year, you can also do the same thing, change or drop an existing Medicare coverage and find another one. You can, let's say if you have Medicare Advantage, you can drop it and go for Medicare Original. Okay, Medicare Original. And then we have the general enrollment period from January to 31st as well. You can enroll in Part A, Part B. If in case you miss the initial enrollment period, you can use that time to enroll. And then we have the special enrollment period. That lasts for about 8 months of the year. So for 8 months of the year, you can actually enroll, okay? So this is, let's say after your employment ends, you can enroll in Part A and Part B. Then you can add Medicare supplement, the Medigap to it, and then you can also add Part D to it. So you realize there's a lot of times that you can actually have time to enroll. Within the year, you can actually enroll almost at any time of the year. If you need time, if you need more information about enrollment periods, please call me, text me, contact me, and I help you out. Okay, good. Now, I want us to look at the premiums for 2024. The monthly premiums. I want you to know what you're going to pay if in case you have to enroll in any of the parts. Okay. Now, for Part A, which is for your medical insurance, that one is by the federal government, so you pay $0. That one is covered by the federal government, so you pay $0 in premium, $0. Now, Part B, which is your medical insurance, is also provided by the federal government. The most people pay, actually, this one depends on, like I said, your income. So if you are classified as, a low-income family or low-income individual, you might pay you might pay $0 to $0. You might pay nothing. But normally, the average is $174.70. Okay? But like I said, most people pay $0. Depending on your income. Others might pay a little bit more than $278 or $505, depending on how long you've been paying your Medicare taxes. So your premium depends on your income, on your financial situation. So please take advantage of it. Now the Part C, which is Medicare Advantage, combining A and B and the D, the prices vary because it depends on, the plans that you have. Okay, but Medicare Advantage plans are offered by private companies. The government takes care of A and B. Private companies normally takes care of the Part C, the Medicare Advantage, because it's all combined. It's combined A, B, and D. So the price varies. And then Part D, which is mostly for drug coverage, for prescription drug coverage, is also offered by private companies. Okay. It also depends on your income. I know mostly they may pay about $55 or something like that or less, or you might even end up paying $0, something like that. You need to check it out. But the point is, it's easy, it's cheap, it's not expensive, and you can get a very good coverage for yourself for your children, for your household. You talk to your friends, your loved ones, your family, your community. Share this information because Medicare is available for our health. It's important you get coverage. Okay, you don't need to suffer in silence. Anyway, now we're going to look at Medicaid. What we've been talking about is Medicare. Now we're going to look at Medicaid. And I want you to pay close attention to this. I'm going to take my time here. Medicaid is a program that the federal government and the state government actually take care of. They control that, okay? Is provided by the federal and the state government, okay? Medicare helps provide medical care for people or for low-income individuals, okay? It includes children, pregnant women, the elderly, the disabled, and parents with dependent children who have no other means of paying for their health care. So Medicaid is very important. Your status doesn't matter. You can get Medicaid. Okay, it's important. Okay, now, same as the Medicare eligibility requirement, you have to be a US citizen or you have to be a lawful resident for more than 5 years in this country. And then you must live in a state where you receive your Medicaid benefit. Okay, if you're in Arizona, you're going to receive your Medicaid benefit in the state from the state government, state of Arizona. If you're in New York, you're going to get it from there. Okay, and then the other important thing is you must qualify by MAGI or significant health needs. For you to get Medicaid, you should prove that you have a significant need. I don't even think, okay, Medicaid, the requirement is actually state-based. It's based, each state have their own set of requirements. So what Arizona, the requirements in Arizona might be different from the requirements in another state. But the two most important thing is you have to be a US citizen or you have to be a legal resident and you've been legal resident for about 5 or more years, and you have to, the benefit is going to come from the state in which you live. All right, good. So I'm in the state of Arizona, so I'm going to tell you how good this is. Arizona is actually expanding Medicaid. They're accepting more Medicaid. You can see that things are really changing and it's good. All right. You realize that increase in total Medicaid and CHIP. CHIP is Children's Health Insurance Program. Okay, so total increase in total Medicaid or CHIP enrollment in Arizona since January 2014 was 78%. Okay, now about 320 something thousand 320,000 plus Arizonans or residents disenrolled from Medicaid in 2023. All right. Now, but that's not even the good news for me. The good news is that they've expanded the Medicaid so much that you can enroll any day, anytime. All right. But when you look at the number of Arizonans covered by Medicaid and CHIP from January 2014 to 2023, it's close to 1 million. And now, look at this, it's now 2.2 million, over 2.2 million Arizonans are covered by Medicaid and CHIP as of September 2023, just last year. So, you know, more people are getting it. I think it was because of the COVID-19, you know, people started staying home and trying to, you know, figure things out. And so it's kind of encouraged people to apply for Medicaid and Medicare. But the good news is that it's available and you can get it. It's available to you can get it. Okay. Do you qualify? Do I qualify for Medicare? You should qualify for Medicare. We already said this. But in terms of how much money you're making, you should qualify. Don't let the money you're making scare you for Medicare or Medicaid. You would qualify. You would pay zero out of pocket. I promise you. You need to call and let's figure things out. Okay. So Those who earn less than a certain amount of money, a certain amount of income, qualify for Medicare and Medicaid. This is not just this for Medicaid, but for Medicare and Medicaid. Okay. And it also depends on the state where you live. Okay. So, for example, this is the average. For example, if you're earning between $16,000 to $25,000 a year, that's your yearly income, and you're one person, you qualify. Is below the income federal government poverty line. So you qualify. If you're two of you, okay, if you're a couple or a two household and you are earning, your household income is between 22,000 or close to 23,000, 34,000, you're going to qualify. If you're a family of three or household of three, and you make between 28,000 to 43,000, you qualify. A family of four, between 34 and 52, and so forth, and so on and so forth. So depending on your household income, you can easily qualify. That's why I'm saying that it is very, very important, because if you're a household of five and you're making less than $20,000, you might qualify and pay zero, but I need to check it out. It's rather than just staying or just being quiet and doesn't know anything. So please reach out and let's figure this out together. All right. Now, like I said, I'm in the state of Arizona. So, if you need help, not only with medical assistance, not only Medicare, Medicaid, but if you need assistance with cash assistance, nutrition assistance, we have the Department of Economic Security that will help you out. And there are tips. You go to their website and it said it's tips on how to apply for cash assistance, medical assistance. That's what I'm talking about. Medical assistance, which is Medicare, Medicaid, and nutrition assistance. All right. So if you go to Arizona Department of Economic Security, their website, medical assistance, Medicaid through AHCCCS. It's a long, but it's Arizona Health Complete Containment something system. Arizona Health Cost Complete Cost Containment System. Let me say that again. Arizona Health Complete Cost Containment System. All right. They will help you out. Just go to Arizona Health and you can get Medicare or Medicaid. Okay. So I just brought that for you to know. It's here in Arizona. If you're not in Arizona, in a different state, please check it out. Check out. There's information available to you. If you don't, call me. We'll figure it out together. All right. And then there's how to apply. Here in Arizona, you can apply online for medical assistance. You can just click apply online. You can call, and then they'll just show you what to do. Just call me and I'll help you apply for it. If you want to report the changes in your family or whatever you want to do, you learn how to report changes in your existing Medicare, Medicaid, whatever it is, we can figure it out together. And then if you have more questions, you can also call. Yeah, there it is. Arizona Healthcare Cost Containment System. That is this, right? It's AHCCCC. And Arizona, we call it access. You can get access. You can get access, and it's going to help you. Let me read a little bit. It says, Arizona Healthcare Cost Containment System is Arizona's Medicaid agency that offers healthcare programs to serve Arizona residents. Okay. AHCCCS provides medical insurance coverage to thousands of Arizonans each year, for which Department of Economic Security provides eligibility services. Okay. Health insurance through Arizona Health Cost Containment System helps individuals cover the cost of doctor's visit, physical exams, immunization, prenatal care, hospital care, and prescriptions they need. It's available. Now you know where to get help. If you don't want to call them directly, just call me and we're gonna go and we're gonna do it together. All right. But there's need is available. You can apply for cash assistance, you can apply for food assistance, you can apply for medical assistance. That's for me the most important thing, our health. Number one. All right. Can I get covered now? Absolutely. You can get covered today. If you qualify for Medicaid based on eligibility, you can enroll online all year round, and I can help you do that. If you have a life event, if in case some things have changed in your life, you have a complex application, something going on in your family, or you have a complex application issue, call this number to see if you qualify, or call me and we can figure it out. We can call together and figure it out. If you don't have any of the above, open enrollment then starts from November. If you don't qualify for Medicaid, or you want to wait, you don't have any changes in your life, on your household or whatever, you don't have any complex application, you just want to wait, then you can wait for the open enrollment, which starts from November 15th to I think January 15th or January 14th, thereabout. We can figure it out. And then you can get enrolled. Okay, but you can enroll all year round. It's very important. Okay. See, there you go. Now, I don't know if you heard about a marketplace, but marketplace is where you can actually buy your coverage, your Medicare, Medicaid. We have a Medicare, Medicaid marketplace. Okay. Whether you get coverage from through the marketplace or not, you will need to enroll during the annual open enrollment period unless you qualify for special enrollment or Medicaid or CHIP. That's what I wanted you to know here. Unless you qualify, and I know most of us are going to qualify for this. So you don't have to wait for November 1st to start the enrollment period, because now the enrollment for 2024 is being passed. But if you qualify for Medicaid or the Children's Health Insurance Program, you can enroll all year round. And I'm talking to those families with children. Please call me or go online or go to Department of Economic Security here in Arizona. Go to our local offices and they can help you enroll, especially with your children, because there are children's programs available to help you and your family. Okay. And that's what I'm talking about. CHIP is Children's Health Insurance Program. It's available for children. You've got to get your kids covered, okay? And the thing is, CHIP helps nearly 9 million children per year. You need to make sure your children are involved in it. Let your children be covered. Cover them with healthcare. Let them go to the doctor, okay? Children that are enrolled in CHIP are 25% more likely to get checkups than uninsured children. So your children can get free checkup. You don't need to wait. You don't need to struggle or stress about it. There's programs available for the children, okay? And you know what CHIP provides? The Children's Health Insurance Program. Children's Health Insurance Program. You know the things it provides? Routine checkups, free. Immunization, free. Doctor's visit, free. Prescription, free. Dental and vision care, free. Inpatient and outpatient, free. Hospital care, free. Lab and x-ray services, free. Emergency services, free. If you are from a low-income community or a low-income family, free. These things are free to you. If you earn very, very little, if you are classified or you meet the federal government poverty lines, you get these things for free. Please, it's important, okay? The rate of uninsured children dropped 15%, from 15% to 5% since CHIP became a law, or since CHIP was created. CHIP, Children's Health Insurance Program. If you have a child, CHIP is for you, okay? You can get a lot of things for free. All right. Now, newborns, if you have a wife is pregnant, she's gonna get care. And then once she has a baby in the hospital, newborns leave hospital with health insurance. They get insured before you come home. Thanks to CHIP. Children receive continuous health care during critical development stage from 0 to 6. Thanks to CHIP. It's available. Children start school ready to learn because of CHIP. Why? Because they go for routine checkups, they go to doctor's visit, they get all that good stuff and they stay healthy. So it's all good and it's available, okay? Children will maintain coverage without unnecessary administrative red tape. Children will get coverage. Your child, your children, your loved ones, our future leaders can get coverage without any problem. Okay. Continuous eligibility in Medicaid and CHIP protects children from losing health coverage if family income temporarily changes. If your family income changes, if you have no income or your income is drastically reduced, whatever the situation is, you can get coverage. You can get health care through Medicare, Medicaid, and the CHIP for your children. This is very important, okay? All right. So let's just look at the summary of what I just said, the summary of Medicare and Medicaid. Okay, so Medicare is administered by the federal government. Medicaid is administered by the state government with the support from the federal government, okay, right here. Now, for coverage, for Medicare, you're going to get medical services, hospital care, certain prescription drugs, and then Medigap for other stuff, okay? For Medicaid, you're going to get good health coverage. You're going to get prescription drugs. You're going to get dental care. You're going to get eye and other health services. It's there. And then for cost, don't worry too much about cost. It depends on your on your financial situation. Okay. For Medicare, for cost, you pay premiums from zero to whatever how much you're earning. If you're working, if you're not working, there are programs to help you get for free. Deductibles, co-pays, co-insurance as per federal guidelines. See, so you pay your premium based on federal guidelines. Okay. Now, the cost for Medicaid is the same thing. Premiums, deductibles, co-pays, and co-insurance are as per state guidelines. So this is really, really important. So again, please share this information with your friends, your loved ones, your families, your neighbors. Please share it to whoever. It doesn't matter which state a person lives in. If they want to hear this, they need to hear it. It's important. Please do not suffer in silence. There's help available for whatever you need. Okay? All right. Thank you so much. I'll come your way again very soon at another video. And then we're all going to learn and we're all going to know what to do when we need help. All right. Now, this is how to contact Medicare. In the state of Arizona, you just just call them. Call them by phone. Medicare, call them by phone. You call them your fax, email, or you can just, this is Kansas, but I'm not even worried about that. This is Arizona. They have everything. They have their phone numbers here. We can call them online. You can call the Arizona Relay Services. You just check this out. Check this out. If you want a long term, say, you see Alt C or how is Arizona Long-Term Care Services or system. You call them if you need long-term care, you can get it. Okay. You can call to verify your eligibility. You can call to report changes. You need to call to apply. It's there. If you don't want to go through all that, then call me on any of these numbers here. Those are my numbers. Okay. You can also send me email, newlifeagency@gmail.com, or you can schedule free online appointment with me, and I help you out at newlifeagency.com/appointment, or call my cell phone number, or call these office lines, or call these lines, and I will help you out. But anyway, if you don't need my help, it's okay. Just Google your local agent, wherever you are, and they're going to help you out. But the bottom line is, please go get yourself and your family and loved ones covered with health insurance. Medicare and Medicaid is available to everyone in this country. Thank you, and I'll see you soon. Okay, bye. I'm gonna stop sharing my screen. And I said, so guys, please, I want you to know that there's help available. Please don't suffer in silence, okay? If you know anybody that is going to help benefit from this video, please share with them, forward it to them, let them hear it, let them listen to it, let them contact me if they need help, because we can help each other. Caring for each other is very, very important. Jesus said it. If you're a Christian, God said it. If you don't believe in God or Jesus, it's okay. You can still share with your friends. Okay, sharing is caring. All right. So I want you all to stay safe and please go get yourself covered with health care. Okay? Medicare, Medicaid is available to all of us. God bless you all. Bye-bye.